Have you ever wondered what controls your mood, sleep, digestion, wound, and even sexual desire? Meet serotonin. Now you might be thinking, what's this serotonin? It's a chemical that your body produces, specifically in the brain and the intestines. This chemical, or to use the scientific term neurotransmitter, is responsible for transmitting signals in the brain. Serotonin is often termed as the feel-good neurotransmitter because it contributes significantly to our feelings of well-being and happiness. But serotonin is not just about making us feel good. It's also involved in a range of body functions, including the regulation of our sleep-wake cycle, appetite, and digestion. You see, when it comes to sleep, serotonin acts like a switch. It helps kickstart the process that tells your brain it's time to sleep or wake up. That's why when your serotonin levels are balanced, you usually have a good sleep pattern. Speaking of appetite and digestion, serotonin helps regulate these as well. It controls your cravings and feelings of satiety, which means it plays a significant role in how and when you eat. Plus, around 90% of your body's serotonin is found in the gut, where it helps control bowel movements and function. Serotonin also plays a key role in cognitive functions, impacting our memory and learning capabilities. But serotonin's most famous role is perhaps in managing our moods. It's instrumental in preventing depression and anxiety and maintaining overall mental health. In fact, many antidepressants work by increasing the levels of serotonin in the brain, so it's clear that serotonin plays a significant role in our overall health. But what happens when things go wrong? You see, just like with other things in life, too much or too little of a good thing can lead to problems. And with serotonin, it's no different. When this balance is disrupted, it can lead to a potentially life-threatening condition known as Serotonin Syndrome. But we'll delve into that in the next chapter. So, stay tuned. Use our time-stamped key moments in the description below. We've broken the video down into chapters so that you can easily follow along or skip to a section that is of interest to you. Imagine having too much of a good thing. That's what serotonin syndrome is all about. You see, serotonin is a neurotransmitter, a type of chemical that helps transmit signals in the brain. It carries messages between nerve cells in the brain and throughout your body. It's often called the feel-good hormone because it contributes to well-being and happiness. But like anything in life, too much of it can lead to trouble. So what happens when there's an overabundance of serotonin in your system? Well, that's when we start talking about serotonin syndrome. It's a condition that can occur when your body has too much serotonin, typically as a result of medication, especially those used to treat depression, anxiety, and migraines. Certain vitamins and supplements can also cause drug interactions. Serotonin syndrome can manifest with a range of symptoms, and they can vary from mild to severe. You might feel restless or agitated, experience a rapid heart rate or high blood pressure. You could have dilated pupils, heavy sweating, diarrhea, or even lose coordination. Severe symptoms can include high fever, seizures, irregular heartbeat, and unconsciousness. It's quite a list, isn't it? Now you might be wondering, why is it dangerous? Well, in severe cases, if left untreated, serotonin syndrome can be fatal. It can cause severe muscle breakdown, seizures, and high body temperature, all of which can lead to life-threatening complications like kidney failure or respiratory failure. That's why it's so important to understand what serotonin syndrome is and how to recognize its symptoms. Awareness is key. If you or someone you know are taking medication that affects serotonin levels and starts to show these symptoms, it's crucial to seek medical attention immediately. Also make it a practice to keep your primary care physician aware of all your medications, vitamin, and supplement intake. So, serotonin syndrome is essentially a state of serotonin overload, and it's a serious condition that should never be taken lightly. But here's the million-dollar question. What causes this overload? What tips the scale from beneficial to harmful when it comes to serotonin? Let's dive into that in the next scene. Serotonin syndrome doesn't just happen. It has specific triggers. Let's unravel these triggers, which primarily revolve around certain medications and their interactions. At its core, serotonin syndrome is caused by an excess of serotonin, a crucial neurotransmitter, in your brain. Now, what might cause this excess? It's often linked to the use of certain drugs, either prescribed or recreational, that increase serotonin production or decrease its absorption. One main factor is the use of selective serotonin reuptake inhibitors, or SSRIs, which are commonly prescribed for depression and anxiety disorders. These medications work by blocking the reabsorption of serotonin into neurons, hence increasing the level of serotonin in the brain. Sometimes, it's not just one drug, but a combination of medications that can tip the balance. For instance, combining SSRIs with monoamine oxidase inhibitors, another class of antidepressants, can significantly elevate serotonin levels. It's like a double whammy for your brain's serotonin balance. Over-the-counter drugs and dietary supplements, too, can contribute to serotonin syndrome. Certain cough medicines, herbal supplements like St. John's wort, and even some migraine medications can lead to a serotonin overload when combined with other serotonin-boosting drugs. Recreational drugs, such as ecstasy or LSD, are also known culprits. These substances can cause a sharp surge in serotonin levels, leading to a rapid onset of serotonin syndrome, sometimes in just a matter of hours. Lastly, an overdose of any of these serotonin-increasing drugs can trigger the syndrome. It's crucial to always adhere to the prescribed dosage and never self-medicate, especially when dealing with these potent substances. And it's important to remember that everyone reacts differently to medications. What causes an excess of serotonin in one person may not have the same effect in another. This is why it's essential to have open and honest discussions with your doctor about all the medications you're taking, even over-the-counter vitamins and supplements. Let's move on to why early recognition is so important. Time is of the essence when dealing with serotonin syndrome. This is a statement that rings true across the board. Serotonin syndrome is like a ticking time bomb. The longer it goes unnoticed, the more severe the fallout can be. Early recognition and treatment are crucial in preventing serious complications and in some cases can be life-saving. So let's talk about the importance of early recognition. Picture this. You're watching a movie, and right from the start, you can sense that something's not quite right. You're not sure what it is, but you know something is off. That's exactly how early recognition works with serotonin syndrome. It's about picking up on those subtle cues that something's amiss and then taking action. Recognizing the symptoms early can make a world of difference in the outcome. Symptoms like agitation, restlessness, and rapid heart rate may seem mild at first, but if left unchecked, they can escalate. The body can go into shock, and in severe cases, it can even lead to death. It's not a scenario anyone wants to face, but it's a reality we need to be aware of. But here's the good news. Early recognition leads to early treatment, and early treatment often leads to better outcomes. It's like catching a small fire before it becomes a blazing inferno. The quicker you can get to it, the easier it is to put out. Now let's take a moment to talk about the importance of early treatment. Once serotonin syndrome is identified, the next step is to stop the use of serotonin-affecting medications and begin treatment to manage the symptoms. This could involve anything from administering drugs to counteract the serotonin to supportive care like hydration and rest. Remember, time is a critical factor. The sooner the treatment begins, the less damage is done, and the better the chances of a full recovery. So, don't underestimate the power of early recognition. It's a key player in the battle against serotonin syndrome. Now, let's summarize what we've learned today. Let's take a moment to review the key points about serotonin syndrome. We've embarked on a journey of understanding serotonin, a vital neurotransmitter that plays a pivotal role in our mental health. It's essential in maintaining our mood, appetite, and sleep, among other things. We dived into the challenge of serotonin syndrome, a potentially life-threatening condition that arises when there's too much serotonin in the brain. This can result from an overdose of certain drugs or a combination of medications that affect serotonin levels. Symptoms can range from shivering and diarrhea to severe muscle rigidity, fever, and seizures. It's a serious condition that requires immediate medical attention. We explored the causes of serotonin syndrome, emphasizing that it's often linked to the use of certain drugs. These can include prescribed medications, over-the-counter cough medicines, illegal drugs, and dietary supplements. It's crucial to be aware of the potential risks when taking these substances, particularly if you're using more than one drug that affects serotonin levels. We highlighted the critical importance of early recognition and treatment of serotonin syndrome. The sooner it's detected, the better the chances of a full recovery without any serious complications. If you or someone else is showing signs of serotonin syndrome, don't hesitate to seek medical help immediately. In conclusion, serotonin syndrome is a serious and potentially life-threatening condition that everyone should be aware of. It's crucial to exercise caution when taking medications that affect serotonin levels and to seek medical help if you suspect you or someone else might have this condition. Our journey doesn't end here, though. There's always more to learn and explore in the realm of psychology and mental health. Let's continue this journey together, expanding our knowledge and understanding to better care for ourselves and those around us. In a world where access to medications and vitamins is as easy as a click of a mouse, make it a practice to always discuss your medications, supplements, and vitamin intake with your doctors across all modalities. It could save your life one day. Your health is in your hands. Stay informed, stay safe. We hope you found this information helpful. As we've explored today, serotonin syndrome is a serious condition that requires our attention and understanding. We've just scratched the surface and there's so much more to learn. If you have personal experiences with serotonin syndrome or any insights to share, we encourage you to contribute to the conversation in the comments section below. Your story could help others recognize the signs and seek help sooner. If you have questions, don't hesitate to ask them. We're here to help make complex psychological concepts more accessible and easy to understand. And remember, if you found value in this video, be sure to subscribe to our channel for more psychology-related content. We're committed to empowering you with knowledge about mental health. Thank you for watching. Remember, knowledge is power. Stay informed and take care of your mental health. Like and subscribe to join us on a journey of discovery as we seek to understand the fundamental aspects of human behavior, emotions, cognition, and relationships. Stay curious, and until next time.